Yeah, see, they're working over there. They're working over there. Um, so yesterday, talking about memberships and stuff, yesterday I was at Vaughn's with Joy. We were getting some stuff for today, and we encountered a very nice couple. And is Claudia here? Joy, do you remember Claudia? No, you don't see her. Okay. So anyway, as you meet people in, you're representing Silayan Filipina, you naturally go into conversations, and she was really excited to be here today, and so she took a picture of everything, so she might come. So my point in that is that we connect. Silayan Filipina connects with so many people, and just sharing our mission and vision and our core values is such an important part of who we are. um, the other thing is, I'm not going to take too long on this, but part the other thing is, I have a story to tell you. Okay, so after the Vons thing, I went out with some friends for dinner, and you're talking and talking, and eventually, you talk about all different things in life, talk about everything. Mm-hmm. And most always, when you're with your friends, your girlfriends especially, you talk about men, right? We have two here, three. You guys are good. You guys are good. So, and we're talking about relationships, of course, and then it got to the point where we've had relationships that come and they go. They're successful and they're not successful. Well, as for my story is that I've been in relationships where they didn't work, of course, and not my fault. Never. So talked about, and I have a girlfriend named, I have my friend Carol, and our lives are parallel, and we've experienced the same things in our relationship. And I have a point to this, I promise. And one of them, after the last, when she was with somebody and broke up, I was with somebody and broke up. So it was very, very parallel. And then at the end of the last relationship that we had that didn't work out, we said, we're through. I'm just done, right, with men. Sorry, no offense. And then we said, well, if we did have another relationship, if we were blessed with another, companion, someone to spend life with, I would welcome it. But I have a list of non-negotiables that this person has to have, right? And so I had maybe, I don't know, 5, 6, 7 of non-negotiables, top 3, right? One of them is, they had to have a good relationship with his mom. That's to me is the number one. And my mom used to always tell me that, and I didn't listen. So the other ones, but anyway, so my friend said, she knows her friend that had, guess how many things that she had on her list? Give me a number. 97. I'm like, whoa, that's a lot, And so you're asking now, well, what does that have to do with this wellness and health and, breathwork stuff that we're going to have today? Well, think of yourself right now. Think of those top 3 non-negotiable things that you're going to do that you have for yourself, for your wellness, for your health. What are those 3, 4, or 5 non-negotiables that you have? So think about it. You want to shout one out? Faith. Family. Bag of Cheetos for me. Okay. Anything else?
Must love dogs.
Must love dogs. Okay. Yeah, self-care. So that ties in what we're doing today. We have our fantastic presenters, Dr. Tess, Dr. Jana, Leanne, and Dr. Valencia here. So while they're going through their presentations, think in the back of your head, oh, that's going to be on my list of non-negotiables. Things that I'm going to have for my own health, for my own self, for my well-being. So we're going to go ahead and get the ball rolling here. I'm going to introduce a board member. She's the co-chair for our health and wellness, Dr. Jana Mauricio Lee.
Thank you everyone for coming. This is exciting. What a great turnout. This is really cool to be able to do. This is officially one of my first workshops leading as a full-fledged doctor. Thank you guys for having me. Just a little bit about me. I graduated from medical school last year at Loma Linda, and now I'm a first-year internal medicine resident at Scripps Green in La Jolla. And I'm just very excited to be here. I'll be talking later about cardiac health as well as hormones and menopause. But I think what we all need, especially talking about our priorities, what we're going to take from today, I think we could use a little bit of relaxing. We could use a little bit of centering with ourselves. And there's no one better to do this than Miss Leanne Kim. She, like my mom was saying earlier, she leads our yoga classes here, and she's wonderful. And I think we'll do this all as a group. That way we can all be present in the moment and have something to take away that we can have as a practice.
Oh, thank you. We're just going right into it?
Before we forget, can we just do a selfie? We're gonna do a selfie from here. We capture everybody. Oh yeah, it's doable. Okay, make sure you're in the shot. Okay, come here.
Oh, okay.
I'll come here. Yeah, come on. Go and stand with me. I don't think you can see her. Yeah. What? There's some. Go more. You saw me. Go in. At least get in. Please.
Come on, Dean. We have to crunch down.
I can't see, so.
Yeah, I'll go.
Ready? 1, 2, 3.
Amazing.
Yeah.
Everybody.
Huh?
That's great.
That was my sister's.
Okay, to bring my notes out. I'm gonna just check to see if the music works here. Thanks. Hey, hi everybody. All right, I'm kind of nervous. So like everybody who has ever had to speak in front of anyone else, you know, that energy. And someone was asking me, how do you deal with that when you're really nervous? And when you're present to it, you can say, well, it's not a bad thing. I'm actually just excited. I'm excited to share. And it's because I care so much, right? So thank you for sharing your energy with me today. I don't know, I feel like you could hear my voice without using the microphone, yeah? Okay, so I just want to share with you a little bit about breath work. How many of you have never done intentional conscious breath work? Okay, so there's a few of you. So which means a lot of you have done like Wim Hof, or you've done holotropic breath work, no, or pranayama. Yeah, okay, yeah.
What's that? Vinyasa yoga?
Yeah, but yeah, okay.
Not heated yoga.
The heated yoga is different than pranayama, like breath work. So what I wanted to share with you is, thank you for trying. I just want you to know that if you're worried about doing this breath work, you're always in control. So if there's some place where you're like, I don't want to do this, just open your eyes and just, you know, take a break. I will say that breath work is the #1 tool that we have with us always. We have it at the beginning of life, and it's the last thing that we have before we cross to the other side. And sometimes we forget that. And it's the #1 tool that we have to calm down our stress, to regulate our nervous system, to improve our focus, to boost our energy. And honestly, if you do the breath work consistently enough, it gives you great sleep. It brings more oxygen into your blood. It's great for your immunity, etc., etc. And in fact, now they say that lung capacity is the #1 key marker for longevity, right? But most of us, the truth is, we don't think about breathing. So we breathe right from here to here, most of us, right? And when we sleep, we breathe out of our mouth, right? And they know now, they say that mouth breathing is nowhere near as good as nasal breathing, right? So we're going to work on breathing into our belly today. And again, just remember that, you know, you're always in control. The style that I'm going to show you or share with you is called elemental rhythm. It's a practice that I intersected with in Costa Rica. And when I discovered it, I was like, it was so feminine, unlike other kind of breath work. And it allowed me to really get in touch with myself in a deeper way so quickly. And I thought, like, this is something that I want to share with my sisters and my family and my community. So it's called elemental rhythm because it's very rhythmic. It goes to the beat of music. So it's not going to be like this. It's going to be a little bit like this. So it's good because you have the rest of the afternoon to like really feel pumped up to learn more about yourself. And there's 4 cadences. You don't have to remember, but I like to know what's coming, right? So the first one is a nice grounding breath. It's called earth breath. 4 counts in through the nose, 4 counts out through the mouth. So let's just bring our hands on our belly here and let's just practice. And as you inhale, I want you to think about pressing into your hands. So inhale, press into the belly for 4, 3, 2, 1. Exhale, 4, 3, 2, 1. Inhale, 4, 3, 2, 1. Exhale, 4, 3, 2, 1. Okay. So you get so it's going to belly, chest, exhale through the mouth. Okay. The next is going to be kind of a flow breath. It's like water. 2 counts in, 2 counts out. So inhale for 2, out for 2. Then we move into a little bit of work where it's air breath. 1 in, 1 out. And then for the last 20 seconds, which is where the work really gets heated, it's called fire breath. It's as fast as you want to go. So for me, I like to breathe in and out of my nose. Or you could breathe, but it's only for 20 seconds. At the end of each round, we're going to hold at the very top. And in holotropic breath work, they make you hold for 2 minutes. And I'm like, I can't do that. So we're going to hold at the top for about 10, 20 seconds. You'll feel all that energy come up. And then when we release, we're going to buzz through our nose, which stimulates the vagus nerve, just like this. Inhale. And then, down, right? Just feels really, really good. So that's what we'll do. We have 2 rounds, 7 minutes. And at the end, I will lead you through a heart-centered meditation. You can decide whether you want to participate or not. And if at any time you feel like a little bit of tingling or temperature change, know that that's just part of the practice. And if you feel like this is too much, just open your eyes. Okay. So if you have anything in your hands, I would suggest just take everything out. And if you're crossing your feet, maybe have both feet on the ground. And let's just take some time to get really comfortable in our chairs. So sit back. And if your feet are on the ground, I want you to press into your toes gently to feel the earth underneath you and know that you are safe and you are grounded. And notice the back of the chair on your spine and your hips on the chair, knowing that the chair is doing all of the work. And see if you can give just 5% more. Relax the shoulders and slow everything down. And then from this place, I invite you to think of something that you're grateful for in this very moment. And as you visualize that, I invite you to bring it from your head space into your heart space. And then on your next inhale, let's breathe right into that chest space in the center of your chest. Deep breath in, breath out. And let's savor this gratitude and that sensation in the heart. And I invite you now to set an intention for this short practice. And this intention could be something as simple as being open to a new experience. It could be just being present with my breath, or it could be something like self-love. Whatever your intention, let's welcome it into the room. And let's seal that intention with a deep breath in, deep breath out. One more time, inhale. Exhale. Stay right here. Let's just go to a nice natural breath. And then I'm going to change the music as we prepare for our 2 rounds of breath work here. And I invite you to keep your eyes closed because this allows you to go really inward and to really stay present in the moment. So as I change the music, just stay with your breath here. And we're going to start with nice grounding earth breaths here. We get to the beat. It'll be 4 counts into the nose, 4 counts out through the mouth. Just do your best and just follow my prompts. Keep breathing. Okay, here we go. In, 2, 3, 4, and out. 2, 3, 4. Belly, chest, exhale. 2, 3, 4. In, fill up, let it go. 2, 3, 4. In and out. Feel this grounding breath as it connects you with the earth and Pachamama. Keep going. In, 2, 3, 4, and out. 2 more rounds. In and out. In and out. We transition to water. In, 2, out, 2. In and out. Belly, chest, exhale. Belly, chest, exhale. Keep going and listen to the rhythm of the music. Allow it to really take you away out of your heart, out of your head and into your body. In, out. Into, out. To stay with this breath. And in just a few more rounds, we're going to bring it into air to keep flowing. Into, out, 2. Into, out, 2. Let's prepare to increase it to air. 1 in, 1 out. Here we go. In, out, in, out, in, out. Really push the air out. And imagine that you're pulling in lots of prana, all that life force. You're doing great. Believe and trust is the process. In, out, in, out, in, out, in, out. In just a few more, we go into that fire breath just to do the best that you can. Remember, you're always in control. 3, 2, 1, let it go. Fire breath, in and out, in and out, in and out. Either through the nose or nose through the mouth. We're not here for long, but build that fire from within. Keep going. 5, 4, 3, 2, 1. Let's take a deep breath in. Inhale. Hold at the top, hold. Close down your chin. Hug the belly in. Squeeze your pelvic floor. And just notice the energy coming all the way up through the spine to the crown of your head. And then now let's buzz it out to empty. And when you're ready, let's come back to a natural breath as we go back into round 2. Great job. I'm so proud of you. We're all halfway there. Let's go into that steady breath, preparing for earth breath. Here we go. In, 2, 3, 4, and out. Belly, chest, exhale, let it out. This is the foundation as we move forward. In, 2, 3, 4, and now let's let it flow. Here we go. In, 2, out, 2, in, and out. Imagine like water is running right through you, cleansing and washing away anything that no longer serves you. In and out. Each breath, you're even more present in the body. Stay with me. In, 2, out, 2, in, and out. Relax the shoulders and imagine that you're flowing with the ocean. In, out, in, and out. In just a few more rounds, we're going to increase it and go into that air breath. One in, one out. Keep going. You got this. 3, 2, 1. Let's go. In, out, in, ha. Pull in what you need and push away what you don't. Out, in, out, in, out. Out of your head and into your body. Don't think too much. Trust the process and surrender. In, out, in, out, in, out, in, out, in, out. Keep going. Just a few more. I'm hanging with you. In 5, we're going to go to our fire breath. 4, 3, 2, and 1. Fire breath. Build that fire from the inside out as fast as you can, whatever is within your capacity. This is our last round, so give it all that you got if you can. In and out. Really push the air out. In 5 counts, we hold at the top. Keep going. Last 3, 2, and 1. Inhale all the way to the top. Hold it here. Hug the belly in. We're going to hold a little bit more because I know that you can. But if you need to let go, I totally understand. But hold the belly in. Inhale. And then when you're ready, buzz it out through the nose. Lips are sealed. Let's go all the way to empty. And when you hit empty, hold it there in stillness. 3, 2, 1. Slowly come back to your natural breath. You did it. Made it on the other side. Stay here as we move into our meditation. Relax your shoulders. Relax your body. Just notice what's happening here. That you're so present. Each breath is deeper than the last. Slow everything down. And I invite you now to think of a moment in your life where you felt an immense sense of gratitude and joy. It could be the birth of a child. It could be a time in nature, watching a sunset. It could be something that you overcame. But there is that one specific moment. And I invite you to go to that very moment and stop time. Invite it into your mind and your body. Just notice who's with you. Visualize it. Maybe you can see sights and colors. Maybe a scent. And slowly, let's bring that feeling of that gratitude to the center of your chest. And on your next inhale, let's breathe in the feeling of gratitude and joy right through your heart. And as you breathe, you're sending that gratitude to every cell in your body. Keep following the breath. Feel the rise and fall of your chest. Feel the weight of your body on the chair connected to the earth. The simple fact that you are here, that you're alive and breathing, is a gift. Let this gratitude expand throughout yourself. An option to bring your hand on your heart and just notice the feeling and the warmth of your palm on your chest. And you may say to yourself and to your body, thank you, body, for being with me in this lifetime. I may not have always been kind to you, but in this moment, I thank you. And to my breath, I thank you for never leaving me, for being with me. Gratitude for every step, every mistake, every teacher that has brought you here to this very moment. Now I want you to imagine underneath your palm, there is a doorway. And I invite you to walk right into that doorway, into your heart. And now you are home. And here, there is nothing to do, nothing to fix, nothing to perform, just complete safety, trust that you're at the right place at the right time. Make some time to savor this place, get to know it, and to remember that this breath, this space, this place of gratitude is always here. We think that we can find it outside of ourselves, but it's right here, always waiting for you. Let's take a deep breath in. Release the hands, wiggle your fingers, wiggle your toes. You can move your neck from side to side. And notice, again, the sit bones on the seat, feet in the ground. And then I invite you to open up your ears. Just hear little sounds around the room. And then tune your mind like a radio station. Let's tune our minds to our higher selves. And then we could tune our minds to the energy of each other in this room. We're all made of energy. As you feel that merging of the energy, the beautiful energy in this room, let's take a deep breath in. Deep breath out. Slowly. Thank you, my dear sister. So I hope that that was, it was good for me. I don't know about you all, but I felt your energy. And so if this is your first time doing breath work, be great. Like, just be tender with yourself and gentle with yourself. Breath work is so incredibly powerful. And this is a modality that I just feel like, especially for Asian Americans, we just, all our lives, we're just holding our breath and we're in fight or flight, you know, because we're just trying to save everybody and do all the things for everyone. And then there's a point in our lives where you can't do that anymore and you just have to exhale and let it go. And so the breath work is kind of helping us to remember who we truly are and bringing us back home again and again. So I wish all of you a wonderful rest of the seminar. Thank you, Dr. Tess. Thank you, Luna, for allowing me to lead this breath work. And I hope that you can also share my information with everyone. I'm on Facebook and Instagram. So if any of you would like to explore more breath work with me or anything, please let me know. So
Thank you. Thank you, Leanne. Wow. I was almost in tears, so it's happened to me many times in class.
you
Leanne.
know what I failed to mention is that breath work tends to bring up a lot of emotion. It could be sadness, it could be joy, it could be love, it could be anger. And it's when it does, I should have mentioned this, we welcome it with open arms because it's energy that needs to get out, right? We are so used to swallowing our feelings just for the sake of everyone else. And here's your sacred time to let it out. And so as you continue doing your own breath work and things come up, let it move through you because it needs to get out, right? Thank you so much for sharing that. I really appreciate it.
Okay, now he's off to change.
Okay.
Climb up and MC. All right. So thank you, Leanne. We turn on the light. So we hold yoga classes here on Mondays. That's how I like to start our week with my team. So my staff, my team. So you're all welcome too. I know many of you maybe live down south, but if you want to make the trek here, Leanne is teaching a full hour of yoga, and it is very, very healing. So first, I just want to welcome all of you. I can't believe it. It's a packed room. Amazing. Let's give yourselves a round of applause because this is a commitment to yourself. And I just want to say that today is very special for me on a personal level because, of course, it's the first time. I know this will be first of many because she doesn't have a choice. So I always get her to do stuff. First of many health, wellness, and of course, beauty seminars. Um, with my daughter, our only daughter, Dr. James, you get credit too. Dr. Jana Mauricio Lee, and she will, speak first. But obviously, we are beyond thrilled and proud. And when Leanne said, "Think of a moment where you're, super grateful," I actually thought about your birth. Anyways. I used to be stronger before menopause. Now I get emotional and gets in the way of work. So anyway, but yeah, so just so grateful for you, Jana. I know that God has brought you here to really, really impact and help women, especially to live their best lives. This has been my life's goal and mission as well. And I know that you're brought here to continue that, expand that, and so we'll let you take the stage. This is Dr. Jana Mauricio Lee, my daughter.
Thank you, Mom. All right, well, we're getting the slides turned on here. I'll just introduce a little bit about what I'm going to talk about. So, in thinking about what I wanted to present today, what would be relevant to women, especially Filipino women, earlier this year in February was Heart Month, and you might remember all the messages to send in the picture of you guys wearing red. So that's why I really thought it would be a great idea to kind of talk about heart health, specifically in women. All right, getting the good camera angles. And then what else is something that also only happens to women? Menopause and hormones. And there's been so many innovations and so much more research since my mom was in med school versus now. And I think that there's so many things that we have to learn as far as the public. So I really am excited to share this all with you guys today. Perfect. And do we have a clicker, or I'll just let you know when to advance?
Yeah, I just have to.
Okay, awesome. So I'm going to be presenting today on women's heart health and hormones. Go ahead, next slide. So what I'll be talking about, this is just a brief overview. Number one, I'll be talking about heart disease basics. What are the terms you should all know when we say heart disease? Number two, what are our risk factors as females that make us more at risk for heart disease or developing heart disease? Things that might have happened when you were young that could put you at higher risk that you should just be aware of when you go to your doctors. And three, there are ways that women present with heart disease that are different than men that you may not realize, oh man, is this a heart attack? What's happening to me? So just things to be aware of. And then we'll transition into menopause. So basic menopause, basic pathophysiology, things to look out for. And then 5, I'm going to talk about hormone replacement therapy. And then lastly, I really want to make sure today I want you to take away some myth busting about hormone therapy. I know that there's been a lot of discussion. Is this safe? Can I use this? And the FDA has made some changes in their guidelines. So I just want to make sure that we're all on the same page leaving today. All right. So the heart truth. Hold on, we're going to move this. You can see my slides a little bit better. So heart disease is the #1 cause of death for women. Full stop, right? And over 60 million women in the US are currently living with heart disease, 44%. And that's not even taking into account the fact that we as Filipinos are at higher risk of heart disease because we have so much hypertension, hyperlipidemia, diabetes. So this is even an underestimation of what Filipino women and Filipino people are living with right now as far as heart disease goes. So really important. And I'm sure many of us in the room today are living with heart disease. And then just some basic definitions. When we talk about heart disease, we're mainly talking about these three main categories of diseases. So heart failure sounds really scary, right? Oh no, I was diagnosed with heart failure. This doesn't mean your heart stopped. It just means that your heart is weak. It's not pumping enough or as much as a healthy person's would. So it's the pump function of your heart. Next is coronary artery disease, which I'm sure many of you are very familiar with. This is when you have the plaques in your arteries that causes the blood flow to be difficult to get to your heart, to get to the rest of your organs. This is why it's so important to get your cholesterol checked every year, because it can lead to coronary artery disease, plaque in the arteries of your heart. And then lastly, on the bottom is arrhythmia. So you can kind of tell from the word a and rhythm. So it's a rhythm of your heart that's off. So your heart can be beating too fast. It can be beating too slow. It can be in rhythm that's in a weird rhythm. But that can also lead to heart disease. It can cause the muscles of your heart to grow in funny ways because your heart is beating differently. It can cause your heart to stretch out because the blood is not flowing correctly. So all of these are encompassed in heart disease when we're talking about it. And then next, I want to talk about cardiac risk in females. Of course, as always, we always have more on our plate than men. So our cardiac risk is everything men have plus this. So I'm going to go into the atypical presentation in cardiac events a little bit more in detail on my next slide, but just know that women present differently than men. And unfortunately, most of the studies for cardiac health and the presentation of heart attacks has been done in men. So we say atypical because that's just what has been studied, but it doesn't mean that you are an atypical patient or anything like that. And then adverse pregnancy outcomes. So if when you were pregnant, you experienced any of these: gestational hypertension, gestational diabetes, or a preterm labor, that actually puts you at higher risk for heart disease later on in life. So even after you're pregnant in your 50s and your 60s, you're at higher risk because that happened to you when you were pregnant. And then, of course, certain breast or reproductive cancers, if you had treatments that were hormone centered, that can put you at higher risk for heart disease and plaque buildup as well. And then I added this specifically for our group here of Filipino women. We have caretaker burden, right? You're always worrying about other people taking care of your husband first, your kids first, and you're not worrying about yourself, and your health is in the backseat, and that can lead to worsening of your chronic diseases, not just heart disease, but health in general. And that's really important when we're talking about prevention of heart disease as well as treatment. And then menopause. Love to talk about menopause. So because hormones are so important, these hormonal changes lead to things that can put you at higher risk for heart disease during your menopausal shifts. So your blood pressure increases, the distribution of your fat increases. So you get more of the fat around your belly, you lose muscle mass, your cholesterol and your blood sugar metabolism changes. So these will all put you at higher risk. And that's why it's really important to do your primary care screenings every year. And then, like I said, not just menopause, but hormonal changes in general with your monthly cycle. You don't feel great every single day. That's just how it is to be a woman, and we deal with it every month, right? But that can impact your ability to adhere to lifestyle changes, lifestyle management. So you won't always feel like working out an hour every day or adhering to the healthy diet. I know when I'm on my period, I need to eat dark chocolate. And that's just something that I know about myself. But these are things as women that we have to think about. And when we go to our doctor, you say, hey, like, these things happened to me in pregnancy, or I had this cancer. So what is my risk? So you have these things on the top of your mind. And I really want to talk about this. I labeled this slide, is this a heart attack? So in medical school, they said, oh, these are the symptoms of a heart attack, right? Chest pain, the pain radiates to your jaw, chest tightness, you get kind of sweaty. But they said, oh, but caveat, sometimes women present differently, and then they move on. What does that mean? So when women have heart attacks, quote unquote, when they have heart attacks, they can present completely differently from men. So yes, they can have those classic symptoms: chest pain, jaw pain. If the pain goes down to your left arm, you're sweaty, you're short of breath, but you can also have this. It can present with nausea, anxiety, weakness in your body. You can feel like you're having indigestion or GERD, or you can just feel very, very fatigued out of nowhere. So all of these symptoms can happen just on their own in coordination with other things, but just things to be aware of where if you go to the emergency room and you're feeling them, I don't want them to dismiss your symptoms because you should say, Dr. Jana said that women present with heart attacks differently, and there's nothing wrong with just getting an EKG, right? And then I'm going to talk about patient hesitancy. So the way that women present when they do have narrowing of the arteries in their hearts, they have more pain more frequently than men do. So you'll come in with chest pain, and we know that maybe you have a blockage in your heart, but it's not enough blockage for us to put a stent in or do an intervention or take you to the cath lab. So then we send you home, and that can be very frustrating for patients to feel like they've been dismissed. Your chest pain is real. You're just not meeting the percentage cutoffs that our studies have. So we aren't legally supposed to put those stents in you, and that can make you more hesitant to come to the doctors or to present to the emergency room. But that doesn't mean that your symptoms are not real, and that doesn't mean that you're not having blockage of the blood flow in your heart. And then lastly, women get different diseases than men do on average for heart disease. So when we think of a heart attack, we think of the very classic, okay, we have a clot in one of the arteries of your heart, it's completely blocked off, and that's what a heart attack is. You get the chest pain. But women are slightly different. We get things like, I'll explain this. So increased rates of MINOCA. So MINOCA is myocardial infarction with non-obstructive cardiac arteries. So a heart attack, but there's no obstruction, right? There's no clot for us to go in and fix. And that's related to stress. It's related to spasming of the arteries. And that is a completely different pathophysiology than a regular heart attack that men would present with, right? We can get takotsubo. That's an interesting word. It comes from a Japanese name for an octopus trap or it can be called broken heart syndrome, because when we look at your heart, when you have this, it looks like an octopus trap. It bells out at the bottom, and this is caused by stress. So they call it broken heart syndrome. So someone in your life passed away, you had a breakup, and you feel like you're having a heart attack. And then we look at your heart on an ultrasound, and it's actually Takotsubo syndrome. And that's completely different than a heart attack. And then SCAD, so that's spontaneous coronary artery dissection. So that can happen. It's like a stress-related issue, or if you have connective tissue disease, that's a different disease process. So like I said, these are microvascular or stress-related, completely different than men. So that's another reason why we present differently. So as far as our cardiac health for women, I want you to take these away. These are very simple. So know your personal or your gendered risk factors, right? I talked to you about those. When you go into your primary care doctor, have those at the top of mind. Hey, I might be at higher risk, and then you think about your gendered risk factors, and also your family history comes into play. And then don't delay. Have an action plan for if you have any of those symptoms. So don't delay. You can call 911, go to the emergency department, and then when we're admitting patients, one of the best things you can do is have your story, know your timeline. When did the symptoms start? What are your symptoms? And then have your medication list. That's really helpful for us, okay? And then comorbidity control. Easier said than done, but make sure your weight is at a healthy place, right? Your lipids are controlled. You're taking your medications as prescribed. You're walking, your diet, you're having a good Mediterranean diet. And then this is actually a guideline that we tell all of our patients. 150 minutes of moderate to high aerobic intensity per week. Okay? Yeah. And the way that we define moderate or high intensity is if you can talk normally, that's not it. You want to feel like you can't finish a full sentence when you're doing that aerobic activity. And then my last takeaway is prioritize your own health, right? You guys are all worried about everyone else at all times, but it's really important to pour into yourself and pour into your own health, because this will pay off in the future. Okay? Next thing I want to talk about is menopause and hormone replacement. For those of you who can't read that, it's a funny cartoon I found that said, "I'm just in the middle of menopause. Can I call you back in about 5 years?" And obviously, I'm not there yet at that time in my life, but I see a lot of patients in menopause or postmenopausal, and they don't have the education that we have now, right? There's so much has changed in medical education and in research, And I really want to make sure that you guys feel empowered, not only in your own education, but to bring it up with your doctor when you see them. Hey, Dr. Jana told me about these things. Am I a candidate? Can I try this? And I really want you guys to feel empowered to do so. Okay, look at this slide. Who's overwhelmed? Yeah. I don't want you to focus on what the words are saying. I just want you to know this is what's happening in your body when you're going into menopause, right? So many things are happening, but what it all comes down to is estrogen. Estrogen is so important to all of your bodily functions, right? And if you're nerdy, you can take a picture of this and do a little studying of it when you're home. But go ahead to the next slide. What I want you to focus on is this, everything in the green boxes. So this is what estrogen is important for. And when you lose that estrogen that your body was producing on its own, you can lead to this: depression, hot flashes, chills, decreased libido, urinary tract infections, pain with sex, urinary incontinence, and it can actually make your cholesterol worse, right? So estrogen is so important to all of these things. And that is why you feel the way that you do during menopause. And no one should discount or discredit those symptoms because it's real. It's here. I took this from the Calgary Guide, okay? And then some basic definitions. So perimenopause. So that's when your symptoms start. You start having variable menstrual cycles. This can last up to 10 years. So you can be perimenopausal for a long time. But when does it become menopause? That's when you go 12 whole months without a period. So that's how you know, okay, I'm in menopause or I'm menopausal. And on average, that's about 51 years old. And then I'm going to use these terms when I'm presenting. So vasomotor symptoms. What is that? Hot flashes, night sweats, you have palpitations, increased heart rate, dizziness, and sleep disturbances. So that's one of the these vasomotor symptoms cause huge impacts on quality of life for women in menopause. And then the genitourinary syndrome of menopause, vaginal dryness, vaginal irritation, pain with sex, and frequent urinary tract infections. So these affect most of the women who go through menopause, right? So menopausal hormone therapy, what is it? It's when we replace the estrogen, and maybe give you progesterone as well. The difference between that is if you have your uterus still. So if you had a hysterectomy, you don't need progesterone. But most women will get both estrogen and progesterone. So when do we use it? Hormone therapy is the most effective treatment for vasomotor symptoms, what I was just talking about. And in select patients, it can actually prevent osteoporosis. And then you also use it for the genitourinary syndrome as well. But for that specifically, if that's what you're coming in with mainly, we would just use the vaginal estrogen. We wouldn't use systemic estrogen. And it comes in many formulations. You can do oral, you can do a gel, a patch, or just in the vaginal area. And then timing. So most optimal timing would be less than 60 years old or less than 10 years since you started menopause. And the reason for that is we have some data saying that if you start it during these times, it actually can help your cardiovascular risk later on. And then we reassess this annually. Usually you're on it for about 5 years, but you can take it for as long as you need it, as long as you're having symptoms. And then what are the benefits, right? 70 to 90% improvement in your hot flashes. 60 to 80% improvement in your genitourinary syndromes. It'll improve your sleep quality, reduce your awakenings. It'll improve your mood, your memory, the heart and cholesterol benefits I talked about. And then, like I said, you can increase your bone density and reduce your fracture risk. And then, of course, any medication is not without its own risks. It has a very minimal increase in stroke risk, but look at how small that is. 2 additional cases per 10,000, right? And then blood clots. If you're just doing the transdermal or the cream, very minimal to no risk. The risk only comes when you're doing the oral form. And then these are our contraindications. So if you had these in the past, estrogen positive breast cancer, active blood clots or prior blood clots, stroke or heart disease or liver disease, because estrogen is processed in the liver, you're not a good candidate for hormone replacement therapy. But other than that, you should be okay to have it. And I really want to harp on this. The data has evolved, right? So the Human Health and Human Services actually is removing the black box label from hormone replacement therapy. There's a label on hormone replacement therapy based on a study done in 2002 that said okay, we think this is causing breast cancer, and then they put a black label on hormone replacement therapy. So many of you have probably heard this myth, okay? Hormone replacement therapy can cause breast cancer, but this was based on data from the study. It was done in women over the age of 63 and using hormone therapy that we don't use in everyday practice. So they actually discounted that study and want doctors to be more willing to prescribe hormone therapy and make sure that the public is educated on this. And then these are some of the myths about hormone replacement therapy. Raise your hand if you've seen any of these. Hormone replacement can cause stroke or heart attacks. Studies have been showing that if you start the hormone replacement therapy in that window that I was saying, less than 60, less than 10 years since you started menopause, it either has a neutral effect, so it doesn't do anything, or it can even help your risk of heart disease. And then this one, I kind of talked about it already. Hormone replacement causes breast cancer. So in medicine, we rarely say something is causative, right? There can be a correlation. So causing it, no. But if you do use the oral replacement, maybe, or if you have a history of estrogen positive breast cancer, then you are at higher risk. But overall, it's very low. And when you compare it to being overweight, smoking, or drinking alcohol, minimal, right? So if you can cut those things out, that's better than that. Okay. And then for those of you who aren't a candidate for hormone replacement therapy, I wanted to touch on some non-hormonal treatments that you could think about. So an SSRI, a selective serotonin reuptake inhibitor, medications we use for depression or anxiety, usually we can prescribe that to you. It changes the way that your brain processes temperature regulation and will help with the hot flashes. Gabapentin, we usually use for neuropathic pain, but we can use it for hot flashes as well. And then this is a new medication called Veoza. It's a neurokinin inhibitor, and that also works similarly to the SSRIs at regulating your temperature. And then this is something everyone can do, lifestyle management, right? So dressing in breathable layers, having a cool bedroom at night, having a fan. You can have a portable cooling aid, so the towels that cool you, or the neck fans, and regular exercise. Exercising regular is great for your mental health. It'll help you with those fat and body mass changes that I alluded to earlier. And then mind and body therapies, right? We just did one with Leanne. So those are all great for regulating your stress and decreasing your vasomotor symptoms and your quality of life. And these are my takeaway points for menopause and hormonal therapy. So hormone replacement therapy is the most effective treatment for vasomotor symptoms. And like I said, the evidence has evolved very significantly since the 2000s. So really, if you're having these symptoms, bring it up with your doctor and see if you're a candidate, because it has made amazing improvement in the quality of life of patients across the nation. And they may not think that they're a candidate because they're basing these on old assumptions and old data. And then early initiation of hormone replacement therapy is linked to better overall outcomes in terms of morbidity, mortality, lifestyle, and then cardiac risk. And then the route and the formulation matter. So are you going to do oral? Are you going to do the gel? Or do you only need the vaginal cream? Those are things to talk to your primary care or an OB-GYN to see what's best for you. But there are so many different options and formulations. And then lastly, there are non-hormonal options too, for those who are not a candidate. I don't want you to think, oh, I had breast cancer and I don't want to live like this, but I'm not a candidate. There are things that you can try, other options, right? And you should feel empowered with this information that I gave you to be able to take that out in the world and tell your friends. Okay? All right, that's everything from me. And that's me. But you can follow me on Instagram at Dr. Dana ND. Right, and then we'll do questions at the end.
Great job. Aww. Oh, I'll take a picture of you with them.
Oh, okay.
Sorry, guys, I'm a photographer when it's my daughter. Okay, ready? That is a great photo. Babe, you can be in it. And then maybe we take a picture and I'll sit there. Okay, 1, 2, 3, smile. I'll sit there. Sit there. Come here, babe. It's her first, so.
Okay, 1, 2, 3. 1, 2, and 3. Hey.
Thank you. Great job, Jana. We'll do the questions after. And okay, so yes, so we go from menopause to early life. So it's my pleasure to introduce Dr. Mariles Valencia. And Dr. Mariles Valencia is a pediatrician. And so she's like, well, what am I gonna talk to women about? I'm like, gosh, we all take care of kids. And so she's gonna be talking about the earlier life. And I'll give the mic to you. All right, Dr. Valencia. Oh, and before I forget, where is he? Dr. Dovencido. Where is he? He's coming? Huh? Oh, look, he knew it. He knew it. Before you run out, I just want to just acknowledge the presence of the president of the Philippine Medical Association of San Diego, Dr. Joseph Novencido, an amazing, amazing leader for our organization, and we're just so proud of what he's doing. There's a 5K coming up, and we also have talked about maybe incorporating this health, beauty, wellness within his giant 5K run coming up. What's the date?
October 4th.
October 4th. So mark your calendars. I know Silayan was going to be part of it. There's a team. There's a Silayan team. Okay, and okay, we'll have you speak then. This is a good place for you to.
Yay.
Yes, please.
Okay. Well, I'd like to thank Dr. Jana for that nice talk that she gave. So after our talk on hormones and our heart, now we're going to shift gears and talk about what is very special to our heart, but sometimes give us a heart attack as well. We're talking about our children. So most of us are probably done taking care of your children, but now helping take care of your grandkids. So I'm going to talk more about what is relevant to you, and for our even younger, audience, this may be helpful for you also. Okay, so what do you think makes a healthy child? What's their characteristic? Okay, so they are physically healthy, they are mentally developing well, they are emotionally secure, and they are socially confident. And the four foundations of health includes daily activities, a balanced nutrition, physical health, like physical checkups, and also vaccination. And vaccine is the most important protection that you can give to your children. And the last one is adequate amount of sleep. So in a family, in most families, especially in our Filipino culture, children are the center of everything. They are the heart of the family. And while children's environment, social pressure, and technology have changed drastically, the need for protection, the need for connection, and and emotional support stays the same throughout generations. So children need to feel safe. They need to feel seen, heard, and valued. They need their emotions validated and not dismissed. So what are the role of the lolas and the caregivers? So you are not secondary. You are essential. You give them emotional support. You give them unconditional love, stability, especially during family disruption, and you give them wisdom. You are the family historian. You give them, you share history of, of your family, and also you teach them values, and these are important for strengthening the child's identity and also self-esteem. So, do you remember when you were kids? You're not supposed to answer back. You're not supposed to reason out. You're just supposed to, do as they told. Just obey them. But nowadays, we still teach them respect, but we also teach them to be able to express their feelings, their emotions. Okay, anxiety and depression is real in children, and but sometimes it's hard to differentiate a phase and also what is something that we have to be concerned about. But expert says that if the behavior has been going on for more than 2 weeks, it's causing significant emotional distress and affecting them at school and at home. Then it's time to get help. And you need to watch out for withdrawal. Like social withdrawal, things that they like to do before, suddenly they don't have any more interest in it. Mood changes, like they cry too much, or they're persistently sad, or they have outbursts, and sleep problems, either sleeping too much or, not sleeping at all. And when there's a talk about harming themselves and suicidal ideation, that's an emergency. You need to get help like right away. Okay, this is very common nowadays. Too much screen time. Well, we cannot blame the parents. Everybody's so busy right now, and screen helps the children be busy so that the parents can take care of the tasks they have to do. But it's not really good for them. First of all, if it's unsupervised, it's very dangerous for the kids, and also it minimizes their opportunity to be able to build a relationship with other people, like to socialize, to bond with the parents, and also they're not able to go outside and play and be active. And then more pressure, like academic pressure, and also over scheduling. We want the kids to learn, to develop different skills. But then if it's overwhelming them, we need to prioritize and maybe cut down a little bit on their activities. Okay, what do kids need to hear? I'm here for you. Tell me more. It's okay to feel that way. Let's figure it out together. So basically open communication. So you ask them open-ended questions so that it will encourage them to share. You also want to validate their feelings, even though you don't really agree with it. Um, and, and also, you want to connect first before you actually correct the problem. That means you want to establish a relationship, build the trust, make them feel that you understood them, and then you can go ahead and give suggestions or correct the problem. So these are common mistakes that we do. So comparing children, every individual is different. Some people are better at this, but not on other things. We all have our own strengths and weaknesses. So it's better to just encourage them, support them, and praise them for the effort that they do. And again, we talk about dismissing feelings and connecting first before correcting. Oh, this. Okay. So this. Okay. We tend to measure our love for our kids by the amount of food that they put on their plate. But nowadays, we have so much problem with obesity and also the risk of diabetes. So we still want to give that love, but then we need to modify how we give it to them. So balanced meals, half of the plate, fruits and vegetables, half grains and protein. Don't force them to eat. Encourage them, but don't force them. And then avoid, using food as a reward, like saying, oh, if you finish your assignment, you can have your ice cream, cake, chips, and not a good idea. Okay, so simple daily actions. Talk to them 10 to 15 minutes every day. And this is listening without interrupting and no phones. If you can do more hours, that's even better. And again, praise effort and be patient. So they will remember how you made them feel, that you were present and that you love them. And you don't have to be perfect, just be there for them.
Love that. I love that. Oh my God, that was just so excellent. And I love your slides. They're so cute. I will take a picture of you here with this. That was so good, Jana. You think that you're a child and you had Lolo and Lola.
Yeah, I that was really great. As someone who grew up with Lolo and Lola in the home, I definitely felt their love and their presence. But like you said, like things have evolved since you guys were kids, and having that is very good. And when we were thinking about, oh man, what are we gonna present? We all know you guys are Lolas. You love us the most, so that was perfect. That was really great.
Much.
And again, we'll do questions at the end.
Yes. Okay. Right.
Alright.
So, just a little admin. Just want to make sure we do have raffles. Well, my talk is being loaded there. We do have raffles. If you make sure you're in there, I'll talk about the raffle items, but we do have that. And then today's a great opportunity since you're here. You can set up. We do offer free consultations just to get educated. And those of you that booked that today, there's a special raffle for a free hydrofacial. I know that you guys also have tried some of the imaging. You see the fluorescent clogged pores. A hydrofacial will extract that magically. All right, so let's talk about the skin and hair. Obviously, here at M Beauty Clinic, this is what we do. This is my passion because I do feel that when you look your best, you do feel your best. And I've seen many, many patients. I've been in practice now for over 20 years that, you think that it's vanity, but it really is not. And especially as we go through perimenopause, menopause, hard times in our lives through taking care of patients who've gone through illnesses or have lost loved ones, gone through divorce, and just a little bit of a boost where you're getting rid of lines that you don't like or improving the glow of your skin can really, really start this kind of process of self-love, self-care that we all need. So nothing makes a woman more beautiful than a belief that she's beautiful. And I definitely have also taken care of women were physically perfect, but did not believe they were beautiful. And so both are really interconnected. And I know that I think the last time I did a Silayan event, women empowerment, we did the inner beauty and outer beauty quiz, because both we can improve loving ourselves just as we are, and also now more than ever 2026, and I just finished doing a round of conferences in South America, to the American Academy of Dermatology, to the American Medical Spa Association. Within a month, there's so much more. We truly can reverse the aging process, aging in reverse. And also now more than ever, we can address your hair, your skin, and even intimate health, so that you do feel like you're beautiful and you believe that you're beautiful. All right, so let's talk about the latest technology. Those of you who are on social media, you probably have seen Kim Kardashian with this device, and you'll see it. You'll be one of the first in the world, actually, to see the ZERF device. And ZERF, we now have an ability to non-invasively lift and tighten the skin. And as we age, obviously through menopause, you lose estrogen, you lose collagen. Actually, they've estimated that 5 years after menopause, if you haven't done any hormone replacement, you would have lost 30% of your collagen, almost half. And that then translates to
the skin issues that we see, and that will be, loss of elasticity, you're sagging, your wrinkles, you have more sun damage, you have more pigmentation, the skin is not as plump, it's not as rough, not as smooth. And so technologies like ZERF actually reverses that. We actually can rebuild collagen non-invasively, no needles, no downtime. And this device uses multi-frequency, radio frequency. Not only are we now tightening the skin, the dermis, but there is now an ability to tighten what's tightened before only surgery, which is the SMAPs. And that is the fibrous network that lies underneath the skin. And before, the only way to tighten that is to actually get your face and neck lift. But now with ZERF, we are able to deliver radio frequency in that level, and we can tighten that fibrous network, and we can tighten the actual dermis. And so that's why Kim Kardashian said this is now her favorite laser. It's not a laser, it's radio frequency. So it's really good for all skin types. And the bonus for those of you who've heard of Thermage and Ulthera, this one, you barely need numbing. We still numb here, but it's the most comfortable non-surgical skin tightening device available. And you guys will get to see it, take a picture with it, and you're like, yeah, this is the device. And of course, I've had these treatments. They work. These are the types of improvement, and these types of technologies, what it's doing is it's reversing the aging, you're building collagen, but it happens over time. It's not instant, although most patients, after the treatment, they will feel like, oh my God, my skin immediately feels tighter, immediately better, jawline, cheeks are lifted, brows are lifted, the neck. I don't think there's any device out there that's as good for lifting sagging neck without surgery than ZERF. So for those of you look in the mirror, you're like, oh God. And for me, I think this is my problem area, because throughout the years I've treated my face, I've forgotten my neck. But ZERF is really wonderful. You can see there's no surgery there, and it's improvement and the wrinkles, the tightening in their under eyes, a lifting of the cheeks, and even the neck volume is less, because think of the skin as a girdle for fat. There's like fat pads in the under eyes, and so as the skin loses elasticity, the eye bags, the fat just comes out because your girdle is not as good. Same thing here, same thing here. So as the skin tightens up, those fat pads are still there because you didn't get, surgery, but they're better lifted. Same here. And this is a Korean technology. And so my husband being Korean, you can take a look at his skin. He is a patient, because the first patient we actually treated with ZERF, and he actually was such he didn't believe it because it didn't hurt.
Time, I believe that in order to cause enough or do the right job, it needed to hurt a little bit. Right? Bottom line, I believe that firmly until the ZERF came along.
Yeah,
So,
he was such a skeptic, and we treated him, and look at him. Like, I have to stop treating him for a while because he cannot look younger than me. Okay, yeah, so I like him looking good, but he can't look younger, So it's really good for tightening of the under eyes, lifting of the brows. Next. And let's see, what is this, a video? Yeah, so basically, not just the lifting, but when you build collagen, you also improve the fine lines indirectly, right? Because the reasons you have lines is that you lose collagen. The lines are improved. If you had acne scars, those fill in. And so all of those issues, your pores look better, your makeup goes on better, because your skin is really younger. It is a true reset of the aging process. It's not like just putting in fillers or putting in Botox, your skin is younger. So look at her neck and look at the jawline. I mean, she's absolutely a surgical candidate, but there are a lot of people who don't want surgery if there are non-surgical choices that actually work. And some patients will need 2 treatments. These are the types of treatments. It's like working out. You do it, you get better. If you want more, you can get even better. think James has had two. I've had two full treatments since we had it. We're one of the first in the United States to bring on ZERF. And so we're very proud of that. And we combine it with other technologies. If you had acne scars, we can do our time machine with ZERF. You can have Botox if you wanted with that. You can have hydrofacial with that. And these are incredible improvement that was not possible before without surgery. And no downtime. So you can come in, you can have it done, you can go back to work, you can go running, you can go sailing. And so this is probably one of our most popular treatments. And look at her neck. The jawline is more defined. It's snatched. So that's kind of like the social media thing. Oh, you're in a hashtag snatch. Next. So next. So just improvement overall. And the platysmal band, this is a big thing that happens as we age. You get those bands and they really make the neck look aged, and patients hate it. And there are ways to handle that now non-surgically. We can combine ZERF, and then we could address the platysma. There's actually a muscle that goes from the jawline all the way to the clavicle that also pulls down. The action of it is pulling down. So it makes your jowls, kind of more saggy. It brings your cheeks down, and it creates the band. So in addition to ZERF or other things that we can do to improve the skin, like the time machine procedure, we can soften the movement of the muscles using a little bit of Botox and Jeuveau. And I get that done because otherwise you would be, these bands would be very visible, and it's magic. So here's a treatment. This is actually my friend Philip B. He has an incredible line of hair care products, and he's done everything for his neck. And but he never had ZERF. Then you'll see. Okay. Oh, you can't hear it. We'll do the audio because the audio is pretty amazing. This is immediately after. There's the snap. Try that on your necks right now. Is it snapping or is it lagging? So that's kind of what we do for patients. We treat one side, we give them a mirror, and okay, here. See if we can hear him. Did you hear him? No, no audio. Okay, so he was just saying the side that was treated was snapping back, and then the side that's not. Yeah. There, you can really see it there. Yeah, snap, snap. That's what he said. So the right side is the side we treated. Let's see, do it again. Let's play it again and let's see. So snap. Because the radio frequency, again, the energy is gone in there and tightened. And you can see it visibly. The skin on that side is tighter. So, of course, I always practice what I preach. Every single technology that's at M Beauty, we test, we make sure, because there's so many things out there that's just hype. They don't really work. And, it's not worth paying for. And so this is me at our Beverly Hills clinic, getting the treatment by our nurse, Jerry. And so usually if you come in, we'll numb the skin, the face and neck, just topical numbing. And then we'll just do the treatment on your face. That's ultrasound gel. And it's really comfortable. And this is my skin immediately after. You can see, snatched. Face and neck snatched. Okay, next. And this is, again, another treatment. And we can treat not just the face, the neck, but we've treated arms, the knees, any area, the abdomen, any area that of the skin that needs tightening. Yeah, and then let me see this. Huh? Full body, really. We when you come for your free consultation, we will address all of the issues that you have, and we will create a plan and we will prioritize, and then you'll also know how much things cost, so you can plan. You can ask your husband for Christmas gift or anniversary or whatever, everything. There's nothing better than looking younger and feeling good. Okay, so hydrofacial is the other device there. So this is an incredible treatment that is painlessly, forget manual facials. How many of you go in and go to an esthetician and then have them just massage products and then extract pushing things on you that hurts, makes you cry? That is so old fashioned, such old technology that doesn't actually work as well. There's actually studies that show that compared to manual facials, hydrofacial one will actually deliver serums and products deeper in the dermis and actually build collagen, which does not happen when it's just a massage on your skin. So don't waste your money on those. If you want to relax, get a full body massage. And then if you really want clinical improvement in your skin as a facial, get a hydrofacial. So it will deep cleanse your skin. Your skin will never feel cleaner. It exfoliates, it sucks it by vacuum, and we have it here so you can feel it in your skin without pain. So if you have whiteheads, blackheads, and as we get older, our skin actually retains keratin, so it doesn't exfoliate as much as when we were younger, which is why our skin looks more dull. I mean, my skin, even though I get all these treatments, still doesn't look as radiant and bright and glowing as Jana's because we're not exfoliating. And products and regular exfoliation will do that. And then immediately after, your skin will feel smoother. If you have kids with acne or you have acne, this is the best treatment to start with. We actually performed a study to show that hydrofacial clarifying treatments really help with acne and scar. And we published this. And then there's serums and boosters that are administered to your skin on the same day during the same hydrofacials that will have peptides, antioxidant, hyaluronic acid. So you're getting that as well. And then we finish off with a red light treatment. And then I forgot, we also do lymphatic massage. So there's 7 treatments that are done within one visit. So that one, this is the study that so if you have acne, this is a must. And Jana is an author, co-author here. This was published and that's the action. That's vortex fusion. So there's actual very proprietary vacuum as you're delivering fluid, it's also vacuuming. Next. And these are the types of results for acne. And this is just like a month later. So that is the difference. When you manage your problems or skin issues on your own, or you don't go to experts, your suffering will last longer. Right? So this patient was suffering acne, discoloration, scars, and within a single treatment, within a month, she was so much better. And so I really encourage you, if you have teenagers or if you have acne, anyone in your family, to really get them expert help. It really affects their self-confidence. It really affects your mental health. They actually said that they've done studies that say that kids with really severe acne, they have depression just like if they had full body eczema or psoriasis. So don't ignore that. Next slide. But we can help both with active acne and also scarring. Even in all skin types, we can treat. Next. There's hydrofacial, there's peels, there's medications. The advantage of going to a dermatologist versus a med spa. Med spas are usually not owned by a dermatologist. Dermatologists, I mean, most people don't really understand that dermatologists are MDs first, and then we do 1 whole year of internal medicine. So we learn everything, and then 3 years just learning about skin and hair. And so when patients come to us with acne, we also sometimes we'll put them on medications for acne, like spironolactone. They're on, medications on top of getting all of these high-tech treatments. So we can get patients really much better so fast. They don't have to suffer. And even really severe acne, we can really help them, and the scarring. And let me see. So there's the red light. So the red light, you can do this at home, but of course, when it's done here and it's done with your hydrofacial, it is much higher level. And there's a lot of data now showing photomodulation can help decrease inflammation, It can increase collagen production as well, and also drive all of the amazing peptides, serum, hyaluronic acid in the skin. And that's me immediately after, no filter. This just really this beautiful glow. So if you have events, and this is a great maintenance, and it's not really expensive. So I think every single person here needs to try one, and at least, I mean, if you're really being cheap to yourself, twice a year, but really ideally every quarter or even monthly. So this is soft wave. So soft wave is another way to tighten the skin. This is Marla Maples. She's my patient, and she lives in Florida. And if you go on her Instagram, you'll see she looks fantastic in her early 60s. Obviously, she has an incredible lifestyle, but in addition, she has me as her dermatologist for over 10 years, always looking natural as well. And these are the types of results. Soft wave is ultrasound. We can combine it with ZERF. And for certain patients, if you have more acne scars, if you have more wrinkles, because this goes more in the dermis. Next slide. So there's instant improvement as well, and there's no downtime. And then let me just talk about a little bit about lasers for acne, and also just non-surgical ablative treatment, and also hair. So this is a new laser that is really, really safe for all skin types. We can do acne scar reduction without downtime, improve skin texture and tone, not just on the face. It also allows penetration of products that we apply, like exosomes, like peptides, polydeoxyribonucleotide, and also for hair loss, hair restoration. So just before and afters. And this really amazing what we're able to do with acne and acne scars. Next. And even scar treatment like this, where it's very severe. This patient unfortunately went to an esthetician and they burned her skin. So it's really crazy. There are so many things out there that's happening. Don't do things on your own. Go to someone who's an expert. And unfortunately, we end up doing a lot of repair work here. You end up paying for a lot more, and maybe we'll never restore you. But in her case, we really were able to help her. And so hair, just talk a little bit about hair, because it's normal for men and women to lose hair as you age, especially during menopause, and especially if you take one of the GLP-1 medications like Ozempic, Mounjaro, any of those. You will have hair loss, and it can come down in clumps. If you're under stress, you can have something like telogen effluvium, where your hair will just shed, shed, shed. And the key to hair restoration is early intervention, and don't wait until the follicles are dead. So for women especially, sometimes it's nutrition, hormones, or combination, stress. And so what we do with hair restoration is a combination approach. Supplementation, we have an incredible hair gummy that's available there called Extra Say, or not the big pills, but gummies. And it has NAD, it has a lot of vitamins for longevity. So it doesn't just help your hair, it helps you everywhere, because again, our nutritional status reflects on our hair. And platelet-rich plasma is also good. The laser, the Vitins is good. And these are our patients before and afters. Yes, you can get better hair even at any age. Next. And eye bags. Let me just talk about eye bags. This is David Taborowski. Were you like someone raising your hands about eye bags? Yes. Every single Asian person, or I mean, everyone will end up with eye bags. And like I said, it's three things. The fat herniation, and it's a genetic thing. We have that fat pad here. You lose the strength of the skin, so the elasticity, collagen loss. The girdle is not as strong. You now have a weak, useless girdle. And then you have volume loss. So there's separation of the natural fat pad to the cheek fat pad. So now you have what's called a tear trough. And David could have had surgery, so you can have surgery. It's called a blepharoplasty, and doctors usually will also recommend you get a fat transfer, because you got to address the volume loss there. So they'll reposition your fat pad, they'll remove some fat there, they'll cut out some extra skin, they'll do a fat transfer. And then for his upper eyelids, they'll also do blepharoplasty, they'll cut up some skin. And then as you age, the brows also drop. So the lifting that your forehead used to do now can't do it because the skin everywhere sags. And so you also will need a brow lift. Right? So that's kind of what he needed, but he didn't want surgery. So what can we offer? There are now incredible combination therapies. My husband's, we just did his, yes, 2 days ago. We did the platelet rich. Go ahead and play the platelet rich fibrin matrix because he's Korean and Koreans have very, very prominent under eye bags. And so what we did for him is a combination of something called cat scratch, which is a flexor device, plasma device that actually removes the extra skin without cutting. So you can kind of look at James closely. You can look into his eyes later. I allow it just for scientific purposes. You can look into his eyes, and he used to have a lot more sagging in his upper and lower eyelids, but he never had surgery. And then we were able to address the under eye bags as well. So you can see the tightening in the upper and lower eyelids. And then the tear trough, we draw blood. Platelet-rich plasma is your own growth factors. We use it a lot here in beauty clinics. We're leaders in the field called regenerative aesthetics, where we are using our own body's ability to heal and renew and repair. And platelet-rich plasma we use for everywhere, for your hair, for your skin, for your intimate health. There's the O shot, P shot. You guys can guess of what those mean. And then pigmentation, which everybody has, all Asians especially, we can remove in a series of treatments and improve them. You'll need maintenance because you're still alive and you still go out in the sun, but we can, even in 1 or 2 treatments, significantly improve this. And Jeuveau, if you're smiling, if you have the 11s frowning there and forehead lines, and I already talked about how Jeuveau is another brand of Botox. We like it because it's more precise. It feels more natural. You also don't get the same heaviness and dropping of the eyebrows if any of you have had Botox before. And these are the type of wrinkles that we can instantly improve in addition to the neck platysmal bands. The other thing that it helps for is for jaw clenching. If you have TMJ issue, that's addressing the masseter muscle. So if you do that, and you're needing like a guard or it gives you migraines, it's also good for migraines. I treat Jana. So Jana also, that she can't frown. So she looks so, because we treat her for migraines. Yeah. And the forehead lines there. And that's it. What time is it? Pretty good. Pretty good. That was a lot. I covered a lot because I'm like, I have you here. Why not? So let's bring Dr. Mariles back here, Dr. Valencia, and then we'll just do a quick Q&A. And you are all welcome to stay here at M Beauty Life Center as long as you want. We are doing skin and hair analysis there. You can feel the hydrofacial. You can book a free consultation, and then after the Q&A, we'll do the raffle. Okay. All right. So question. Oh, okay.
My question is about melasma, right? The sunspots. So having all being on HRT, I guess.
Try again, try again.
Are you guys filming this? Are you guys filming this? Hello.
Hello. It's such an amazing. I
Hello.
like it. You should use the effect.
I'll try not to touch it. So being on HRT, my understanding is that side effects are melasma. And I guess that's one of the things I struggle with. I was just curious about what treatments are available for that.
Yes, that's a great question because I think it's very common. It's very common for Filipinos, for Asians. Definitely worse with any hormonal change, which is why it can happen during pregnancy. But hormone replacement is notorious. And melasma is very different than just regular sunspots. Sunspots are a lot easier to treat, so we could do IPL. But melasma, it's a change in the actual activity of your pigment cells. And it's very, very reactive to not just UV, but visible light, but also even heat and stress because it's driven by inflammation. And so what we do, because there's so many factors causing it, is we have to do a multimodal approach. So we probably, for someone like you, probably will start with very gentle IPLs. If we get to a point where you're plateauing in your improvement, that means that there's pigment that's deeper. And so we now have the latest and safest laser for melasma and pigmentation on Asian skin. It's called the Pico laser. And so we can also do Pico laser on you. And the other thing that we need to do is really suppress the ability and the activity of the pigment cells. And how we do that, we also offer IV glutathione and vitamin C antioxidant treatments, because what that does is it gives you sort of a internal protection, and it decreases inflammation. And vitamin C will decrease the activity, and glutathione decrease the activity of those pigment cells. And then we'll put you on some products that will, treat all of that, plus also really, really good sunscreen that covers for visible light. So for Asians, we have to really use tinted sunscreen with iron oxide. So we have that here. And so the key is really patience, because we have to do gentle treatments. It's very easy to make your melasma worse if you got a bad peel, if you got a bad laser. So we are very, very careful, and you have to go to someone who is an expert in treating melasma on Filipino skin, because it's totally different settings as well. The hydrofacial also has a brightening treatment, and there's a very, very light and safe peel that can be applied, and brightening products that is applied during the hydrofacial, and exfoliation with the hydrofacial helps with that as well. Okay,
Thank you.
all right. Thank you for your question and for the effect and the laugh. Any other questions? Yes.
Dr. Tess, my daughter has TMJ. So what's the difference between Botox and Jeuveau, and how many treatments does she need to have until, that goes away? Because sometimes she suffers from migraine.
Yeah. So how old is she?
22.
Okay. All right. So, it is very classic that the early 20s, they're very stressed out. And actually during COVID, the number of people with TMJ really shot up because of stress. A lot of people, like, when they're stressed, they're clenched, and you can't stop it. And then you do it while you're sleeping, and you wake up, it hurts. Same thing with this, you're dreaming, you're stressed, and then you create these lines. So the only way to do it is really to address it with Botox or Jeuveau. They're very, very similar. Botox is FDA approved for treatment of the masseters, right? For bruxism. So if you want something that has FDA approval for that indication, then go with Botox. The dosage is 1-to-1. So usually for Botox, we will go with 30 units, 15 units, 15 units, and most patients within a week will feel relief. It's a miracle. It is miraculous for those patients. I treat Angela, my sister. She has that, and also the added benefit that everyone loves is that it also creates an incredible facial slimming, which for my Asian patients, they love that. And it gives you that kind of, that the more heart-shaped oval face look. So it makes you look more feminine and attractive, in addition to treating the pain. So yeah, have her come in, and within that first treatment, she should be a lot better, if
Which
not
one's more
totally.
expensive?
Botox is a little bit more expensive because Jeuveau is cheaper, and they have like a $40 rebate. So that's why in my practice we use more Jeuveau. It's cheaper for patients, and we find that the effect is it's very comparable, if not better, because it's more precise. Yeah. Thank you. Yes, I'll see her soon. Next question. Any other questions? All right. That's it. Okay, all right. So
With that,
Evelyn,
yes, let's give them another round of applause. Dr. Jana, Dr. Tess, Dr. Let, thank you so much. Oh my gosh.
and look
When
at
I
this,
think-
we finished right at the
Yeah.
4. But again, you guys feel free to stay. Network.
I have to tell a story. When I'm with Dr. Tess and I'm talking to her, she's like right there. I'm like, oh my gosh, she's looking at my
And
pores.
I can't help it. But that's being a good friend, right? If your friend, that's what my mom says, like a true friend will tell you what you really need. And so
And we don't want to hear it. But have to do a little bit of Silayan housekeeping. So if you need to renew your membership, we have our fantastic membership director, Jana Lynn. Can you raise your hand over there, Jana Lynn? We do have some upcoming events. So we've got our May tea coming up on May 17th. We also have a golf tournament coming up. There's more information in the back table over there. And I'm gonna make an appointment with you, Dr. Tess.
Yeah.
Okay. So anyway,
This whole thing is worth it just for that.
okay, so and then Dr. James, thank you again for this. Were you doing the scalp thing?
Yeah,
I don't want to
think
go
you can
there.
still go. Yeah, after you guys can try it.
Yeah. And then I want to call up, I want to thank these lovely ladies here. And Leanne isn't here, but we have a special bouquet of flowers for all of you. So thank you so much for this day. For taking your time. Yes. Our pleasure. And last but not least, Lisa, we want to thank you.
Yes,
You're like
for sure.
Dr. Texas assistant, and so we really appreciate all of your help.
We were in Beverly Hills yesterday till early, so thank you, Lisa.
Okay, so that I believe, and then one last thing, our executive director, Joy. A lot of you are wondering, when are going to join? So I'm going to call Joy up. Everybody give a hand for her.
Hey, Joe.
Okay, so this is so cool to see everybody here. You know, we every time Dr. Tess has an event, it's always full house. And thank you to all of you for all that you do for us. But I just wanted to let you know that Silayan is very big on health and wellness, right? Right?
Yes.
So Dr. Tess and Jana are actually our chairpersons for our health and wellness this year. And the last couple months, I don't know if you guys got calls from me and some of the other members, but we were asking for your pictures, right? Wearing red. Some people said, I don't have a picture in red. I'm like, it's okay, just give it to me, Norman. We'll AI you in red. Okay. So honestly, we have over 160 pictures. So thank you. You know, what we're gonna do with this is we're actually gonna have a cardio workshop in about November, October. So that's going to be a big thing. But something happened this last week that I want to share with you because it's very important that we really take a serious look at our health, right? Right. So I had a cataract surgery just a week ago, and I was scheduled for it. And my doctor says, let's do a pre-op. We need to get some pre-op. I'm like, okay, what's that? You know, what do I need to do? So blood work, let's do an EKG and all that. And I'm like, okay, that's great. Because the better you know what's going on in your body, the better, right? So she did an EKG and she's like, there's a little abnormality there. But you know, it could be something old, it can be something that's probably nothing. But I'm going to refer you to a cardiologist. So I'm like, okay, like, what does that mean, right? So I went to a cardiologist and, you know, they did an ultra echogram, which is like an ultrasound of your heart. And they're like, okay, you're clear. Then they did another test. Okay, that's fine, you know. And then he goes, okay, well, let's just do an angiogram. Okay. So that night I'm like, Norman, I like Googling, okay, what's an angiogram, right? Okay. So I got my cataract surgery done. Yeah, don't make that for 2 weeks. But anyway, so I got that done a week ago. And then I had my angiogram a few days ago, which was Wednesday. Well, guess what? They found a blockage. But they did the stent right then and there. Okay. And right after that, the nurses, doctors were telling me, you're so lucky because people usually don't find these out until they have a heart attack. Right? I don't have symptoms. I mean, unless I run up the stairs, and then at the top I'm a little tired, but I don't have any symptoms. I don't have shortness of breath, except now because I walked up. But please, please ask your doctor, request more tests, and really do your diligence because you never know. You never know. And I'm like advocating, with Silayan, right? Get your pictures to me because we're actually going to have a big old presentation on that. But hey, look, I mean, I don't.
That's your good karma.
Yeah,
That's
right?
your good karma,
Because,
Joe.
yeah, because there are times people don't find out till they have a heart attack or a stroke. So they're all going, you're really lucky. And I'm like, yeah, because I didn't even know what was all going on. Okay, so the reason why I have to do this is because this is your main artery. So that's where the catheter went. So I can't just be dancing or doing all kinds of stuff. No. So anyway, so I just want to share that. And yeah, so make sure you get tested. Go back. If you're not happy, just go back and try to get more info about your health, okay?
Yeah. Oh my God. So Joy calls me up that night and she was telling me about it. I go, what? So what's on your list? Remember the list that we talked about earlier? What's one of them? A new one today. Yeah. And they keep telling me there's one more step. So one more. We want to celebrate April birthdays, and one of them is Dr. Jana. She just. We're gonna sing 1, 2, 3, go. Happy birthday to you. Happy birthday to you. Happy birthday, dear Jana. Happy birthday to you. Thank you, guys. Time for that therapy.
Oh,
That's so sweet. Are there any other April birthdays?
Or my Aries sister.
Aries? Oh, yeah. Happy birthday. Okay, again. Happy birthday to you. Happy birthday to you. Happy birthday, dear. Happy birthday to you. All right. Last, they keep signaling me. If you're interested in any membership, just knowing more about Silayan Filipina, again, talk to Jana Lynn. And then Michelle has one more thing before we close out the day. Oh, and then after she does that, Silayan has a little tradition that we do after every event, and that's to take a whole group shot. So please do not leave. We still have the raffles going on too. Okay? All right. Thanks, Michelle.
Okay, promise this will be really quick. But as Ate Evelyn was mentioning that Silayan Filipina has a lot of events coming up. My name is Michelle. I'm the Director of Activities and Events. And I just want to give a few of them to you. So just keep it on your radar because you'll be seeing more of this information on social media, on email. So make sure you plug in and come check these out. So first of all, we have, and it's funny that we were mentioning about exercise and things like that. We've got some Silayan Strong activities. One of them on May 9th is we're going to have actually an aerobics class. And that's headed by one of our Silayan sisters by Christine Young.
Another one in May, as Ati Ev mentioned, we have the Silayan tea. So there are some flyers in the back, so make sure you pick one up. On June 6th, we have a Silayan Strong yoga class, and our instructor is here today, and it's Irene Encarnacion. Highly requested again, so thank you, Irene. Then we have on June 14. How many of you know how to speak Filipino with Tagalog? How many of you? Okay, well, guess what? We're gonna have an event. It's our Kapehan. Where's Carmi? Carmi, there she is. Ask Carmi for any information regarding the June 14th in celebration of Philippine Independence Day. It's gonna be our Kapehan for Anong Say Mo. So it's going to be an interactive time for us to just kind of have some fun, talk some Taglish, and have a good time. It'll be over in Carmel Mountain Ranch area by Mostra. Next, as Ati Ev mentioned, our golf tournament. So that's June 28th. Again, there's flyers in the back. And as we mentioned earlier, with the Carabao Run on October 4th, Silayan Filipina does have a team. So if you'd like to participate, sign up because last year it sold out, right? I think there was over 700 participants, right? So please talk to Atilet. So join the Silayan Strong team, and we're gonna show support that for that event. And again, we have so many more events coming up, and one big one is our Silayan Showcase this year. This year it will be our luau. So it'll be on August 9th. So if you'd like more information, please see Ati Evelyn about that. Thank you, thank you, thank you.
Oh, go ahead, Evelyn. You finished everything. Finish everything. I'm done. Are we finished? Does anyone else want to comment or ask anything? All right. Okay, Dr. Tess, Dr. Jana, Dr. Let, how do you want to do this? Yeah, we're just gonna pull it, but they have to know what they're gonna win. Oh, okay. Yeah. That was amazing. Thank you, everyone, again. This is just so fun, and the fun continues. But so we're talking about hair. So one of you is gonna get started today with the gummies. So yeah, so they're I mean, to me it's so much easier to take the gummies than pills. And also this has incredible, like you said, ingredients, and our patients love them as far as results. And Extra Say is one of the most amazing brands, and they actually we can do a combo treatment with the supplement. There's also an at-home peptide serum with exosomes, and then an actual exosomes from umbilical cord exosomes, decellularized umbilical cord exosomes that can be applied on your scalp here in the clinic that will help grow your hair back. So there's going to be a winner. Jana, do you want? Oh, Evelyn can draw it. Evelyn.
Let me mix it for you.
Okay.
Make it fair. The bottom one's
What
right there
my
too.
name? Ourselves. Person, ourselves. Oh. Okay, so you want me to go forward? Yeah. Go forward. First to Karen Aidenberg. Karen.
I need.
You want it? Okay, I was gonna say, if you don't want it,
I'll
okay.
take it.
Someone is gonna take it, okay. Everybody should be, congratulations. Awesome, awesome, okay. All right, so I guess I might as well talk about it. Yeah, here, actually, just the ingredients, just the one with the ingredients. Yeah, so this is what you're getting, Karen. So all of those signaling factors, immune support. Yeah, vascular promotion. I'll go to the ingredients because I want you guys to take a picture, and then that's all of the ingredients that's there. So again, it's not just supporting. When you support your overall nutrition and health, you will make your hair strong, because the hair is a really amazing, basically sign of how healthy we are. And NAD, how many of you have heard of NAD?
So this is really getting huge in longevity. We actually offer IV NAD infusions in our clinic. And this really powers your mitochondria and your cells and decreases inflammation. And it really allows your cells to be optimally working. And so this is one of the rare supplements where you can take it, orally instead of getting the shot. Okay, great. And, there's the peptide. So if you wanted to do a treatment at home, then you can also at home do the peptide. So the next winner, this is one of my ultimate favorite products. I have it in my purse right now. So as we age, when we lose volume, one of the areas that really suffer is our lips. If you look at old pictures of everybody when they're younger, look at Jana's lips. Mine are not bad because I use products. So one way to revive that and take you back to where it was is injectable hyaluronic acid filler. And that will give you kind of that instant volume. And here we do that, and we do it so that you look absolutely natural. But, wouldn't it be nice if you can, plump your lips back to where it used to be by just using a serum? And we can do that now. And so there is a proprietary patented way to deliver the hyaluronic acid molecule, which in the past it was, go ahead and advance it. It was too big. Go ahead and advance. Yeah, so it's a special way that actually it's like almost like an exosome. It's like a vesicle that goes into deep the dermis, and it's carrying hyaluronic acid. Go ahead, advance. And in the past, you can apply hyaluronic acid, but it'll just sit on the surface of the skin because it's too big. But because of this new way where it's carried by these special vesicles, it actually will deposit where it needs to really plump it up. So unlike other lip plumpers, it's just drawing fluid and making it swollen. Edema, this is not edema. This is actually hyaluronic acid delivered there. And it reaches different layers. Good, and just keep going. And anyways, the winner, see, it's not just in the stratum corneum, and you use it 2 pumps twice a day, and the hyaluronic acid goes all the way deep. So they have a lip product, and they have an under eye because that's also an area where we all lose volume, and then they have a full face product. So, okay, so
I mixed it up really well, I promise.
because this one is so cool. So it comes with that, and it also has these the lip conditioning trio in different shades, and it's different than just like I said, your gloss, because this actually is healing your lips. It has real hyaluronic acid in this technology. So right there, so your lip filler, that's why it's called the replenishing lip filler. Has a hyaluronic acid, it has collagen boosting peptides, elastin, lipofilling ingredient, and I use it, and I actually use it on James. Sorry, babe, I think so. Because when we were going out, Jana got lips from Jana's lips are like from James, except the width is like different mine, but the volume, and he's really over time lost that, and I got so sad. And I tried to convince him. I'm like, can I just please I just inject a little bit of filler? He said no, absolutely. So for him, he's like, no injectable filler. And so I've been waiting for this technology forever, and finally it came. So at night we have this in the night on our nightstand, and I'll put it on me, and I'll put it on him. And you're welcome to take a look at his lips too. So you can take a look at his eyes and lips today, just today. Okay, all right. Okay, and then take a look at the lips. So it's subtle. It's not gonna make you look weird. It'll just bring you back to where it used to be. And over time it builds. It's not like a lip plumper that's just irritating. And 99% of patients showed improvement in 3 weeks. Look at that. So even young people, because the young people really want that, they're getting injectable lip filler. But this way, there's no chance of looking unnatural, getting nodules, all of those things that you worry about. All right. So okay, so who's the winner?
We can only look but not touch, right?
I mean, we've been married 28 years, so you know.
Okay, so the winner is Sally Nanquil.
You want it or not? Are you gonna use it? If you're not gonna use it, someone
Yeah.
might use it. All right. Let me see. Yeah. Okay. I need it. Everybody needs it. Okay. All right. You're welcome. All right. That's it. So have fun. Try taking a picture.
Group shot first, Dr. Tess.
Oh yeah. Let's do a group shot. Norman. Oh, let's give a shout out to Norman.
Norman.
We love you. These are the two. Like I said, the men that are here are the best. They're like James, Norman, Joseph,
Yes.
Michael in there, Ken too. James's brother Ken helped out today. So thank you guys. Okay, let's do a group picture. So how do we do it, Norman? This way? Okay, so let's have, where's Dr. Valencia? Move you.
Everybody in the back, you can stand up.
Everybody in the back, can we have you standing?
Standing.
Oh, yeah.
See your faces.
Grace community. I want to just thank Grace as well. Lisa and Grace. The Castillo sisters.
Josie.
And we do have giveaways from M Beauty.
Okay, eyes right here, eyes. Mouth. Right here. Good. 1, 2, 3. Good. 1, 3, and 1 more. Silayan.
Oh, can you take one from my phone, please?
Go.
We can post it right away.
Yeah. There you go. Eyes right here. Smiles at 1, 2, 3. 1, 2, 3, and 1 more. Silayan. Very good. Perfect.
Thank you. Yeah.
And before you leave, we have something for each of you. Giveaway skincare products from number